understand how it works. To be honest, the studies in humans are not satisfactory in my mind. There are some that shows it work. My personal belief is that it will work. I'd like to see bigger studies. I think it makes sense. Does it have side effects? Of course it has side effects, right? Should it be approved? I think very soon it should. Will it be approved in this country for pain? I doubt it. I doubt it. Finally, psychology. Placebos. How many people think if you respond to a placebo that you probably don't have pain? Good. The fact is, the more pain you have, the more likely you're going to respond to a placebo. Pain is a perception. Why shouldn't it be sensitive to psychological controls? It works. And here's a kicker. Beautiful. Placebo analgesia, placebo pain control, there's good evidence. It can be reversed by naloxone. The data is very good. All right? A guy named Benedetti, I can put you on to some other studies. What that says is it taps into the endorphins, releases endorphins, and off you go. Okay? Acupuncture. In my mind, does acupuncture work? For some people, for sure. How does it work? My reading of the literature, my interpretation, is that it's a placebo. Now remember, that doesn't mean it doesn't work. I just think it's an exotic placebo that uses psychological power, belief, in the system that can actually block pain. I don't, and why do I say this? For two major reasons. It turns out it doesn't make a difference where you put the needles. If it works, it'll work whether the needle's here or here. And more importantly, it doesn't work in children for pain. Under 10 years of age, it's never used. Why not? Well, children are not placebo reactors. When the big needle comes along in the white coat, that's bad news. That's not good news. All right? There's no placebo in a kid. All right? Yeah, I don't want to go to the dentist. There's nothing good about that. Children are not placebo reactors. It takes time. There's a cognitive set to be able to be influenced by that. Remember, medical students say it's the patron saint of acupuncture, but I don't know about that. Anyway, stress and anxiety, the setting. I talked about soldiers who in battlefields don't have pain, football players. This is an interesting picture. Ronald Reagan was shot 20 seconds before this picture was taken. Didn't know he was shot. Nobody knew. Brady was on the ground shot. Everyone's worried about that. Was that an injury stimulus? You bet it was. All right? So the stimulus itself does not determine the pain. There's so much more going on, and the clinician and the friends of the individual need to take that into account. Finally, hypnosis. I happen to think hypnosis is one of the most profound ways to treat pain. I think it's underutilized. If pain is a cognitive thing, a perception, then manipulating cognitive sets should work, and I think it can. And it's very different, by the way. Hypnotic analgesia, which works, is not reversed by naloxone. Clearly doesn't involve the endorphins. As a little aside, how many people think when you go jogging and you feel good, it's endorphins? Few people. There's no evidence for that. All right? How would we test it? Naloxone. I'm waiting to do that experiment to the people in my lab who leave the lab at 3 o'clock in the afternoon and go for a run and say, I got a jogger's high. Give them naloxone. If they never run again, then it's endorphins. Anyway. Here is that area I showed you. Here's the pain, the anterior cingulate gyrus. This is the unpleasantness correlate. Very high. This is the sensory discriminative. Now you hypnotize the subjects. Beautiful study published in Science so that it's no longer unpleasant. What happens? That activity pretty much disappears, but the activity in the sensory part of the brain doesn't, stays the same. In other words, the information got to the brain, but the perception was altered. What a wonderful way to treat pain. How does it work? I don't know, but it illustrates so strongly that pain is much more than a stimulus, and you've got to use everything you can to regulate it. So by summarizing, I'll just leave you with this. Here's the pathway. It's more complex. I didn't go into all the details. The information gets to the brain. That we know about. It's not just a pain pathway. It's a modifiable pathway that changes in the setting of injury. You can treat by targeting changes in the nerve in the skin. You can pour drugs at the cord, and morphine's just one of them. But don't forget that pain's a perception, and you can manipulate the brain. All right? And I'll end by reading you some. I got into this, the students. It started as a joke. I wrote all these stupid poems. For my lectures, I'll read you one. The bane of pain is plainly in the brain. Now, pain is an intricate potion of sensations, cognitions, emotions. Acute pain may be terrible, and when chronic, unbearable. Not something that you treat with mere